As the world continues to combat the spread of coronavirus, which has been recorded in most countries in the world, it is very critical to note that the 24th of March actually represents the World Tuberculosis Day, a day set aside to actually build public awareness on this particular global epidemic called tuberculosis and actually highlight the efforts to eliminate this particular disease. Earlier on, my colleague Trixie Ngado actually had an interview on this particular day in why it's commemorated. Let's just listen into a snippet of that interview, which was held earlier on today.
Middle-income countries, the disease affects primarily those in the poor sectors of society. So it's a disease of the poor. It's also a disease of people with compromised immune functions. So if you're HIV infected, if you're diabetic, you've got chronic kidney disease, any of those conditions can increase your risk of getting tuberculosis disease and dying from it.
Right.
We have, over the years, developed what one would call strategies for controlling TB. In 1993, the World Health Organization declared tuberculosis a global emergency, just like it did recently with COVID-19. And we started with a strategy that was called the DOT strategy.
Yes.
And then we moved on to what was called the Stop TB strategy. And now we have moved on to what is called the End TB strategy. The game plan has changed. The idea here is that now we want to end tuberculosis as a public health threat. By 2030, 2035, we would want tuberculosis not to be the #1 killer of people from a single infectious pathogen.
Yeah, but you've mentioned those strategies. Could you break them down for us?
So the first and very important thing is to have a good political commitment to fight tuberculosis.
Yes.
We have seen that with COVID. Every single president, prime minister has spoken about COVID and outlined what countries will do about COVID. We want to see the same kind of thing continue to happen for TB.
Okay.
We believe, some of us, that COVID will pass. It might, at the end of the day, pass with a lot of people. It might take a lot of people with it as
Already
it goes away.
Yeah.
It is doing that, and it probably might do more damage, but it will pass. And then we might be left with tuberculosis going on, silently killing people out there. And therefore, we would want to see better political commitment, better political coordination.
Right.
We would want to see more resources mobilized for tuberculosis. We would like to see our health system strengthened to be able to fight tuberculosis. We would like to see the private sector involved in the fight against tuberculosis.
Right.
We want to see new drugs and new diagnostics, and maybe eventually a vaccine against tuberculosis.
Yes. Now, I'm curious about your take on this. He has pointed out that tuberculosis basically turned out to be a disease of the poor. Now, how did this affect how quick we could handle it over the years, and how could this also reflect on how we are handling COVID-19?
Yes, there are a lot of delays in the system, so that really comes in, and both the two diseases require early diagnosis.
Right.
That you make a diagnosis as fast as possible.
Sure.
Once somebody is identified, you isolate so that they don't spread. And for those who have the disease, you also look for contacts, and those are what the tuberculosis all have been doing, what you call contact tracing. So you have to look for those who probably were exposed, and then screen them.
Yes.
Those who are symptomatic, subject them to diagnostic apparatus, and if they are diagnosed, isolate and manage. So contact tracing has been one of the lessons that tuberculosis brings on board. The second part of it is the engagement of the community.
Yes.
And I think communities get engaged both in terms of getting the right information and knowing the signs and the symptoms and where to get services.
Yes.
Some of these community actors can also participate in identifying events and potential cases and referring them to the authorities. Putting resources is key, but also making sure that as many actors come in, a proper coordination. So others, I think when I was coming in, I was hearing certain segment of the population feeling like they are not involved,
Yes.
like the deaf.
The deaf, yeah. The
So really
blind.
to make sure that we have proper community engagement, that if it's a communication, it reaches the youth.
Right.
The youth is a unique group. Some of them don't think even that
It's a
the
threat.
risk is
Yeah.
the disease for the elderly. So making sure that everybody understands that everybody is at a risk,
Yeah.
and you have to take action. There are informal settlements. We are talking about social distancing, we are talking about isolation. You are in one room. We are talking about access to basic sanitation and hygiene, what is an issue. So those conversations around how do we work with the existing networks,
Yes.
to really appreciate when we say we are deploying interventions, does it speak to this, is it speaking to that context?
Right.
Yes.
And Dr. Jeremiah, if we're being realistic, when you look at some of these urban settlements even, there's a lot of difficulty in trying to contain, whether you're talking about TB or COVID-19, you cannot tell a family that lives in a shanty, you know, to step out, or even that 100 meters literally might be the entire room. So what has been applied to the handling of TB that could be applied to the fight against COVID-19 when we're looking at these two conditions and trying to figure out how we can actually help certain communities deal with it?
Like Dr. Langati has said, the key thing really is to identify people who are sick with the disease early, because these are the transmitters. And even today, if you look at how the epidemic has been, the COVID-19 epidemic, for example, has spread around in the places that are highly affected. Nearly a third or more of those infections are household infections.
Right.
And then another third are probably close contacts at workplaces and social places and that kind of thing. And that's why the measures that we know have been taken, closure of schools, bars, pubs, and stuff like that. But it all begins with being able to test people.
Yes.
And once you have identified someone who has either COVID or TB, screening everyone around that individual.
Right.
And you start with a smaller group of people that are in the same household with that individual or in the same workplace, and you can expand your screening to a wider population.
Okay.
That's the way we've done it with TB over many years, and successfully so. And I think that is the way things will go with COVID-19 too. And there are similarities there, and I think those many of us are involved both in the fight against TB, and now we will be involved with the fight against COVID, because there's a lot of similarities between these two diseases in terms of transmission dynamics.
Now, Dr. Langat, tracing down people who have possibly been in contact, I can imagine for TB, this was a challenge. Right now, we are facing perhaps around 646 people who could have possibly been in contact with the people who are already infected by the coronavirus. So what would be the headache if you're trying to trace each and every single person, keeping in mind that they also have possibly interacted with other people?
Yeah, it's a challenge.
Yes.
One, first of all, is even to locate where they are, you know, to have the phone numbers, you know, their physical address.
Yeah.
I think that is the starting point. Anybody doing contact tracing must really be able to document where all these people are, and then some might be out of the vicinity, so networking with other actors. You know, maybe your contact has moved to Mombasa, so how do you link up with the county government and the committees within those counties to facilitate contact tracing?
Yeah.
Sometimes even I come to your house and you don't want me to access your house, so there's a lot of people might fight back. The fact that you are coming in masks is also stigmatizing me, so you are branding me in the whole community. That so there is that element of the community seeing you as a risk to the whole society.
Right.
So I think we really have to manage both the repercussion in terms of what the community is ascribing to somebody with a potential suspect for COVID, and also making sure that as you also do this contact tracing, protecting the healthcare workers. So it's a bit of, there's no simple way of doing it, but I think for us, we are appealing that these are human beings. Any of us can get infected, and therefore we should accept.